Morena tātou, he mihi nui ki a koutou, tēnā kōrua, Peter Mayor Darius, ngā rangatira, ko Waio, ko Dina Mayor tōku ingoa. Mayor is my surname. It's very difficult to pronounce. It looks like Mayor of the City, but people get it wrong all the time, so thank you for just saying Dina. I work for the Education Review Office. My current role is as a Manager, Review and Improvement Services in the Tamaki Makaurau office, so our region covers Auckland and Northland. In my past life, I did some work in National Office, and from my time in National Office, I worked alongside our Chief Executive, and I would go to meetings with our Chief Executive, Nick, and with Peter. So I know from those experiences that Peter represents this organisation very strongly in the national space, and I just want to reiterate what Nancy said earlier in terms of Peter's proactiveness in raising concerns with ERO. In my role now, we have in our Auckland office now 20 reviewers with experience in early childhood. So that has been a team increase from around 6 to 20. And it was because we wanted to shift our focus into the early childhood space and to ensure that we could schedule every review with at least one early childhood reviewer on the team. And that is based on feedback that we have had from the sector in the past, that there was a sense that the people coming out to undertake the reviews didn't have the knowledge of the early childhood context that the sector wanted. So we have done some huge work in that space. What I've been asked to come and talk with you about today is about compliance do's and don'ts. And I am going to look to Tanya because the initial brief was ERO and Ministry, and we want you to talk to us about compliance. So I'm going to start off with the presentation and then, as with the other presenters, open it up to the floor. So first of all, I just really want to differentiate between the role that the Ministry has and the role that ERO has. So we are the external evaluation agency. We don't have a role as a regulatory body. That is the Ministry's role. So what our role is to undertake visits to early childhood services and schools and report those findings firstly to the Minister but also to members of the public. So that's our key role. As part of that role, we work with the Ministry to verify that services are meeting the aspects of compliance that are required in the licensing criteria. Now, you'll all be aware, I'm sure, that we have a new evaluation framework, Ngā Arawhaihua, and that evaluation framework outlines our strength and focus on accountability and improvement. And what I've certainly taken from the room today, what we've certainly heard through social media, what we've certainly heard from previous community meetings that I've been at, is definitely the terminology around overzealous and not being rational. Yeah, so what the messages that I've heard so far today in the room are consistent with the messaging that is coming both into our office, to me at a manager level, to my director, and to the Chief Executive in Wellington. So I just want to assure you that what I've heard today, even though everyone looked at me and went, oh, what's Sarah going to say when she gets up? They are messages that we have heard before, that we have elevated to our senior team, and as per the other previous speakers, I am in a position where I will be able to take messages back, but I won't necessarily be able to answer them today. And I know that's probably disappointing and frustrating. It would be remiss of me to give you an answer in a space that I'm not able to do so or have the delegated authority to do so. So I just want to share that information with you. The other thing I want to put on the table really strongly is Ero's whakatauki, ko te tamaiti te pūtake o te kaupapa. And that's very much the child is the heart of the matter. It's why you all do what you do, and it's why you go to work every day, and it's also why people at Ero and in the ministry come to work every day, because children are our passion and our priority. So I want to preface the information that I'm going to share with you next in that space, ko te tamaiti te pūtake, because in the end, everything comes back to what's happening to our tamariki and our services. I want to go back to te reo whakamuri, kia ora whakamua. So sometimes you have to go back in order to move forward. And I just want to take us back to where He Po Tātaki took us. So He Po Tātaki positioned non-compliance as the responsibility of the service provider to implement and monitor. So in that space, Ero looked at, are there systems in the service? Are there systems in the service to ensure compliance is being met? We had the perspective that the implementation of those systems was the responsibility of the service provider to monitor. So we looked at were they present, and the service provider's role was to implement them. Since 2008, we've verified systems that are of high risk to children. So if you go back to your services, if you get your past Ero reports, you'll see that there's a paragraph in there and it says management assurance on compliance. And in that section, in that paragraph, it will tell you the 5 or 6 key things that Ero always verified. Is there a system in place for this in this service? So it's in all your Ero reports, and it is still the key things that Ero look at now. What we saw increasingly over the time since He Po Tātaki came in 2011 was a significant increase in the number of non-compliances that were being identified in our Ero reports. And when we did that analysis, we saw that it wasn't just in the services that were not well placed or requires further development. There were non-compliances coming through in the well-placed and in the very well-placed reports as well. And those non-compliances were around the systems not being there, let alone the implementation of those systems. So when we undertook the review of our methodology, we made a commitment to step strongly into that space in terms of, are the systems there, who is monitoring them, and how is the service provider at this service assured that what is happening and what is being implemented, so the difference between a system and the implementation of the system for tamariki. And that's the space we stepped into a couple of years ago. You'll be aware in 2019 we implemented akanuku reviews, which is the review that is focused on sustained or maintained compliance with the licensing criteria. And that was because what we were seeing is that there were quite a significant number of services that had a change of ownership or had been not well placed or had been newly licensed, and they weren't maintaining compliance with the licensing criteria. So we stepped into that space 2 years ago, and then in October last year we shifted into our akarangi approach. Since that time, what I really want to share with you is how closely we work with the ministry. And we work closely with the ministry because the regulatory space is very, very complex. And for me as a manager who has oversight of review teams working on the ground, they come to me every day with, what should we do in this situation? What should we do in this situation? So part of my role in the Auckland office is to proactively liaise with the ministry. Now that liaison happens formally every day if it needs to. It happens monthly as a formal meeting between the two of us. And part of my role, I also contribute to a national group where the ministry and Ero work together and discuss matters of inconsistency that have been raised with us. I think what we've talked about today is we're not always going to get everything right, and we are human beings after all. But our commitment is more proactively step into that consistency space, because it's really important for our agencies and it's really important for the sector as well. So it's very strongly a work in progress that is deliberate and intentional and very, very regular. We have different roles in the sector. ERO and the reviewers that we work for are very clear that we are not the regulator. Yeah, we are not the regulator, that is the role of the ministry. And so we go to the ministry and we seek their advice and guidance when there is inconsistency happening. And let's be fair, I'm not going to stand here and say it doesn't happen. Yeah, because we know from the feedback that we get from the sector that it does. What I can say is that my agency has a commitment to minimising the frequency with which that's happening, and we do that very proactively. I want to talk to you a little bit about what's been happening in the Akanuku space. So this is data from our last 12 months, and in the last 12 months we have undertaken 350 Akanuku reviews. And 71 of those have transitioned from akarangi. Yeah, so that means across the entire country, there were 71 services in the past 12 months that were notified for an akarangi quality evaluation, and they transitioned into the Akanuku space because of significant non-compliance. What we saw from all of these services are that where the services that were notified as Akanuku, approximately half of them were compliant following the on-site visit. So there was non-compliance in 50% of those services. And for those of you who have had an ERO review, you know we send you the draft report, you get the opportunity to respond and provide the evidence to say we are now compliant. If there is a sense that we're not on the same page with the ministry, we consult with the ministry about the evidence that we get. So you can see from that table that as a result of the unconfirmed process, another quarter of services became compliant. So for all Akanuku reviews, there was 24% that remained non-compliant when they'd had the opportunity to demonstrate compliance with the criteria. And in that situation only is there intervention by the ministry. We have a process for working alongside each other. And the process that we have for working alongside each other, you'll probably, if you've experienced or heard about an immediate risk or an unacceptable risk review, there are very key criteria that would transition a service into an unacceptable risk or an immediate risk space. And those criteria are the health and safety criteria that are on the bottom of this slide. So if you have a review and the review team identifies non-compliance in the areas of medication or excursions or hazards, emergency drills, written emergency plans, or in GMA under safety checking, they are the 6 areas that would constitute a transition into an unacceptable or an immediate risk space. They are also the 6 criteria that is in that paragraph that's been in your reports for the last 10 years. Yeah, so they are the same criteria that ERO verified in the past. We verified if the system was in place. Now we're verifying if it's being implemented. Yeah, and it's about consistent implementation of that. So it's a cue. When we undertake our pre-review information meetings prior to reviews, these are the criteria that we are talking specifically with attendees about. Yeah. In the Akanuku reviews, in addition to safety checking, the key areas of non-compliance that are being identified in services are around health and HR management practices, and that's That's generally around, and I note your point over here, it's generally around induction, and it's also generally around teacher appraisal and implementation of the professional growth cycle. And implementing a process of self-review, and I note your comments over here. So the criteria around self-review is very specific, that it requires particular things, and it's, for example, having a scheduled review cycle. And that is one of the things that the criteria requires that we're often seeing services don't have. So it's a heads up that these are the areas, and we talk about them in our pre-review meetings, these are the areas, particularly around health and safety, those examples there, and safety checking, they are what is resulting in services transitioning into that space. If you have any one of these, plus other non-compliances, you will transition. Yeah, so it has to be one of the 6 there. Plus any else, you will transition. I just want to talk about akarangi very quickly before I finish the presentation. So over the last 9 months, we've notified 240 services, so 240 akarangi reviews, 30% transitioned into an akanuku process, so 1 in 3. Transitioned. And for those services to have transitioned into an akanuku process, they would have had to have the non-compliances that I talked about on the previous slide. Medication, accidents, safety checking, hazards, and there was one more that's not coming into my brain right now. What we can see is in the confirmed reports, 31% had non-compliance, and those non-compliances are non-compliances that do not constitute a need to transition. So what we've got is quite a lot of services who are remaining in the akarangi space, but they still have non-compliances that did not constitute significant enough to transition. So it was 31% when we first started out. The reports at the moment that are in draft, the non-compliance has moved to 1 in 4 reports has non-compliance. And these are services that didn't transition. Yeah? And then of these services, approximately half address their non-compliance. So there are still services that have the opportunity to demonstrate how they've addressed it, and then 14% still non-compliant at the confirmed report stage. So there's a lot of information around about 1 in 4, 1 in 6, 1 in 10. Right now what we're looking at is 1 in 3 transitioning over the last 9 months.